Okay, so I just want to call for a motion to open the meeting for Board of Health, November 2nd, 2021 at 5:31 p.m.
I'll make the motion to start the meeting.
Amy's muted. I second the motion. All in favor? There we go.
Amy, aye.
Beth, aye.
Yep. Okay, I just want to go through a few ground rules before we actually get started on our agenda. First of all, we're going to keep everyone on mute until if you are going to speak during public speak time, then we ask that you either raise your virtual hand or your real hand if you're on video, and either Bree or Jackie will unmute you to speak. And when you do speak, please state your name and your address. To start with, in accordance with Mass General Law, we're required to let you know that this Board of Health meeting is being recorded, and no one else should be recording this meeting for its entirety. We will begin with our public comment portion of the meeting. During this time, public comment speak time is limited to 3 minutes, basically because it looks like we have a lot of people tonight. Please note that during this time, the board will be actively listening to your input for future discussion, but we will not be responding to any input. And if you do have a question for the board, please submit it in writing, as we will not respond during public speak time. And we will just have a later discussion. Also, ground rules during the meeting and public speak time, there will be no disruptions, booing, heckling, or intimidation of any speakers. Do not speak unless you're recognized by the chair. And all speak time is addressed to the board and not to the audience. So with that being said, we can open with public speak time. So I'm not sure if there's somebody that wants to go first. If you could just put your hand up for Bree or Jackie.
Maggie, do you want to call on them and I'll unmute them?
Yeah, I can't see everybody though.
In the chat, Jed Stamus, who looked like the first person who said they wanted to speak.
Okay, yep.
Okay.
So Amanda?
We'll start with Jed and then we'll do Amanda.
Okay.
Sorry.
Thank you for letting me comment. My name is Edward J. Stamus. I live at 13 Meadowbrook Drive in Easthampton. And my public comment, I would like to present some evidence from Public Health Canada Weekly Surveillance Summary titled Adverse Events Following Immunization, AEFIs for COVID-19 in Ontario, December 13th, 2020 to October 24th, 2021. That's the name of the document, and I have a copy of it. It's right over the border in Ontario, a neighboring area with very similar culture. And it states on page 2 that there have been 464 reports of myocarditis or pericarditis after the administration and due to the COVID-19 vaccines. Not a cardiologist, but it's common knowledge that myocarditis and pericarditis are very severe conditions that can and have resulted in death and shortened life expectancy. Some calculations based on the data in this document that that's a rate of 1 in every 5,770 males age 14 to 24 after the second shot. If you include males from 12 to 24, the rate becomes 1 in 6,817. And I'd like to note that all of these males, young men, were highly, highly unlikely to have any risk at all from COVID-19. I believe that this policy, policy that Public Health Canada is continuing is unethical and immoral. And I completely disagree with any similar policies in Massachusetts. It is not ethical to give young men lifelong heart problems in order to protect older people. We know the average age of death for COVID is above average life expectancy. And I don't believe anyone who believes it's morally okay to sacrifice children for the sake of the elderly. All cultures, historically, their morals and ethics have put it the other way around, that children are more important in terms of life years. And even a utilitarian look at ethics says that as well. And furthermore, I know this data is from Canada, but it's similar to the US VAERS database, where we know that the actual number of events could be 10 times higher or
And
more.
I have you at two and a half minutes.
So in conclusion, I just have one conclusion. In conclusion, please oppose the use of COVID-19 medical interventions on minors who cannot give informed consent. It is not backed in scientific data, and it defies the basic principles of medical ethics. Also, please oppose all tyrannical vaccine mandates that constitute coercion. Coercion is the opposite of informed consent, and we know that informed consent is the cornerstone of basic medical ethics principles.
That's time.
Thank you.
Thanks. Maggie, you want to call on the next person?
Maggie, it looks like Amanda M. also wants to comment.
Okay, Amanda.
Find her somewhere.
Why am I not seeing them?
Oh, there you are. Okay, I just asked you to unmute, and you have 3 minutes, just so you know.
Okay. Hi everyone. My name's Amanda Miller. I live at 35 Main Street in Easthampton. I've been a resident for over a decade. I'm here in support of transitioning from a mask mandate to a mask advisory. Springfield, Holyoke, and West Springfield have all lifted their mandates. I understand this board implements the mandate based off the numbers received from the state. I also understand you are all doing what you think is right for the health of our community. However, I'd like to posit that this mandate may perhaps not be in the best interest of our community. Recently, I witnessed the manager of Family Dollar grow flustered and flummoxed over the enforcement of the mandate. She was visibly upset to be dealing with this issue. Why must she serve as an enforcement officer? She already has enough on her hands with inventory, managing employees, and filling in shifts due to labor shortages. Most people do not want the extra responsibility of telling their customers what to do. Adding stress to employment is not prudent at a time when help wanted signs seem to stay up in perpetuity. I have many questions about the numbers this board receives from the state. Namely, I want to know why any board of health trusts these numbers. I want to know who is overseeing the over 300 certified testing sites. I once took a test at a certified site. I swabbed myself in the passenger seat. What would stop me from faking this test? I want to know who is regulating the labs and how many labs there are. From what I can see, there are so many variables to the COVID equation. There's false positives. There's sick people who never test. There's people who commute long distances every day. There's vaccinated people with breakthrough cases. There's asymptomatic people. I genuinely get a sense that you cannot quantify COVID. I know I need to get in touch with the state regarding these questions because I understand you guys are quite busy dealing with contact tracing and all the other pressures pressed upon you at this time. I'm deeply upset that facial coverings have become a political tool. For some bizarre reason, wearing a mask now signifies alignment with the political left. And how is that about health? If facial coverings are mandated to try and truly protect our health, then we'd see standardized, sterilized, government-issued masks. As it stands now, people cover their nose and their mouth with mesh, bandanas, ratty old surgical masks that they've reused for months. Facial coverings have become a laden symbol rather than an effective deterrent to a virus. Perhaps most disturbing is how facial coverings have turned the vaccinated against the unvaccinated. This seeds even greater division and deeper polarization of the people. The vaccinated blame the unvaccinated for the fact they must work 8-hour shifts with a barrier to their breath. It's unfair to place blame on the unvaccinated, as we all know vaccinated people can both contract and spread COVID. Lastly, I don't think remote workers or office workers understand, I'm almost done. the burden these mandates put upon the humans who must wear them for such long periods of time. Wearing a mask should be a choice, not a mandate. And thank you so much for listening. I appreciate all you guys do for the community.
Thank you. Does anyone else have their hand up, either physically or emoji?
It's like Jean. I see
Yep.
Jean.
If you could
I have to find her.
unmute Jean Powell Wilson.
Jean, oh, okay. I just asked you to unmute. Okay.
Okay. Hi, I'm Jean Powell Wilson. I'm a resident of Easthampton for about over 20 years. I have had two children that graduated from the public high school, one last year, well, this year in 2021 and also in 2018. I know that seeing how everything just happened from March 2020 and things changing, I know that has been so much for the Board of Health to try to do the best that you can for the community. And I know that that's our goal and appreciating what you are doing. I'm speaking on behalf of children. I know that the mandates are something that are coming up, and I'm concerned specifically about the vaccine mandates. And I've heard from the Secretary of Education, James Pazer, has mentioned that the mask mandates, he's recommending universal mask mandates to increase the rates of the vaccine mandate. So just in that sentence alone, it makes me wonder what the purpose of the mask mandate is. If this is really about health and safety, it wouldn't be used as a tool to increase the vaccination rates. So there are a host of other reasons for how the masks are. I know that we all wore the masks. I wore the mask too in the beginning, but I see that there are other harmful effects from the masks that we may not be considering. So I wanted to just make an appeal to see if we can consider that, and as well as for the vaccine mandate, just to keep in mind, again, that children are not the ones that we should be trying to vaccinate. They are the ones in this whole group. They really have a good chance of survivability. In the whole nation, the numbers out of 74 million children, there have been 366 that have died. So that even for the mortality rate is 0.00049%. And so just to keep in mind, children are not at great risk. There is a great chance of survivability. Not to say there's no risk, because I know there are people that have been affected. But I just want to ask you to consider, if this isn't even in your jurisdiction at the local level, maybe that's one of my questions about whether you make the decisions. And I want you to just think about, is it worth having these children be at risk for myocarditis and a host of other things?
That's time.
Just from the vaccine. Children are already safe. So, and there's no benefit to taking the vaccine, and having even one death from that would be too many deaths. So I just want to encourage us to have a dialogue and civic discourse to be able to consider what is really in the best interest. Thank you so much for listening. Thank you for your consideration. Thank you for your work.
Thank you.
And it looks like Jennifer Axon has her hand up. Bree?
Yep, Jennifer, I just asked you to unmute.
Hi, my name is Angel Bialik. I am using my son's Zoom. I have been a resident of Easthampton for about 4 years, and I work in the preschool, one of the local preschools around here, and I'm on behalf of my teachers and my I really don't think that a lot of people understand the severity of what these masks are doing. I think it should be up to the parents and not up to the Board of Health. And that by us wearing a mask as teachers, it is affecting our children's social learning. Our kids, my age group, is learning how to speak and how to take social cues, and they can't learn that by wearing masks, not to mention it's hard to breathe when we're working. You know, we have to speak to our children and we have to run around with them. And it's hard to do that when we're forced to wear a mask when we're perfectly healthy people, especially for a virus whose survival rate is 99.9% effective. You know, if you feel scared, if you are nervous, I feel you are more than welcome to wear a mask. But please don't force someone like me who is healthy to have to. Please don't force my kids to do it, especially when I have kids crying and begging me not to put a mask on them because they don't understand why they have to put it on when they're not even at risk necessarily. And you know, we have tried to say something because a majority of the parents that we have talked to at least my school, they're fine with no mask. They're not as worried. And if they are, they tell us. And those kids are wearing masks. So I think it should be left up to the parents' choice, because at the end of the day, that's their children, not yours. If a parent feels that their kid needs to wear it, then they should be able to wear it. I am a healthy human being. I'm willing to take the risk. I have sovereignty over my body. You do not. And honestly, I know me and my fellow teachers are sick of being targeted for not wanting to wear a mask, for not being unvaccinated. It is up to a person, your own body, your own person, to be able to make that choice. And at the end of the day, I think that's what it comes down to.
Especially because it's not a vaccination, it's genetic therapy.
Yeah, exactly.
30 seconds.
Ask that people not address the speaker and the speaker address the board. Thank you.
Well, that's all I have to say. Thank you for letting me share some of your time.
Thank you. Is there anybody else for public speak?
Okay.
In case there are people who don't know, down at the bottom of the screen, there's a smiley face with a plus sign. And if you click that, it allows you to raise your hand. And that allows us to know if you want us to call on you. Again, I'll just reiterate that. There we go. So there's a smiley face with a plus above their head. And when you click that, there's a thumbs up or a hand, and that helps us identify you.
Thank you. I see Michael Hugo, and then just so the board knows, I do have 2 emails that have been requested. I read into the record if you're okay with that, but we'll start with Michael, and then I see Jennifer next. Oh, she just
Jennifer already spoke.
Okay. Michael, I just asked you to unmute.
Okay, hello there. My name is Michael Hugo, and I am the legislative liaison to the Massachusetts Association of Health Boards. And I was actually asked this afternoon if I might drop in and just to respond to any kinds of issues that might be coming up. I don't really see the issues in this group that we've seen across the state in some of the other groups that I've spoken to. But I do want to assure you all of a couple of things. Number one, you have a very, 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 for a small town, you have a very good Board of Health. And you're in very, very good hands in your small town of Easthampton. I was prepared to discuss the masking issue, really, and I just want to assure folks that there's a lot of high emotions around the issue of masking right now, going across not just the Commonwealth of Mass, but we're seeing it nationally. And I've been before a number of boards of health over the past several weeks with some extremely hostile people, which I don't sense or see in this crowd. So I'm not going to do my lecture, so to speak. But I just want to say that the evidence on masking is clear. It's clouded by one issue, which is that there's not a lot of peer-reviewed clinical studies having to do with masking because of the ethics of doing something like that, where you're telling people that you have a control group that you're not going to put masks on and you're going to subject them to a risk. And so there have been most academic institutions have declined doing clinical studies where they don't want to subject somebody to an unnecessary risk. But the basics are that the transmission characteristics of any virus, and I'm not talking just about COVID right now, but any viral infection can be spread through airborne transmission. And the best way to stop that is to stop the transmission. And the best ways to stop the transmission, of course, the easiest is to put a mask over the source, which is a potentially infected person, that would prevent those droplets from leaving that person's orbit. Although there are studies that show that
30 seconds.
That the virus can escape the mask, but masking is the best we have right now, and it's not unreasonable. Boards of health are given the statutory power under the Mass General laws to prevent the spread of disease. That's what your Board of Health's primary purpose is, and they're allowed to take any reasonable steps. I don't see the contest that we've seen in other places where people are saying the Board of Health has no right to do that. I think you all recognize that, with the exception of one thumbs down. And I will duck out at this point. And thank you very much.
Thank you. Is there anybody else? You can either raise hands to the smiley face at the bottom or physically raise your hand. Don't think I see anyone. Maggie, did you want me to read the 2 emails that were requested?
Sure.
Okay, this first one is from Jim Coughlin. In light of recent very low COVID case rates in Easthampton, do you have any plans to suspend your indoor mask mandate? There are several communities in the state with similar populations and demographics that have similar case rates that do not force their citizens to mask up indoors. This week, Springfield has suspended their mask mandate. Our small businesses over the past 18 months have been hit hard. Why make them responsible for mask enforcement? The mask mandate influences whether some patrons visit their businesses. As an example, some people will drive past Big E's to shop at Big Y solely on the basis of the mask mandate. If a business requires or a resident feels more safe wearing masks, that is their choice and their right. I look forward to hearing from you. Sincerely, Jim Coughlin. I actually thought that I saw him earlier, so I don't know if he's actually here, but he did ask me earlier to read it. And then I have one more if you want me to continue.
Yes, please.
This is Jeff Bujak, I believe how to pronounce it. He's the owner of Prodigy Mini Golf and Game Room in Easthampton. I'll keep this as brief as possible, as I'm sure your time is valuable these days. My name is Jeff, and I own Easthampton's beloved mini golf / video game museum, Prodigy Mini Golf and Game Room in Eastworks. In September, when masks were mandated once again, we saw our admission numbers drop massively. The stress that these mandates put on my staff and me is becoming unbearable. With an extremely low 16 active cases in Easthampton as of a couple weeks ago, the lowest I've seen in a long time, my customers and I are left asking, why is this still in effect? I'm a man of personal freedom, but as far for my customers, they want to come here for a good time and not be constantly hounded to keep their masks on in an 8,000 square foot, 14 feet ceiling open area with windows open and at most 20 spaced out people inside. I constantly get comments about how they just came from a restaurant or bar where they are allowed to talk loudly and laugh with their masks off feet from other people, while my place, again, is very open and spaced out where they have to wear one the entire time. I kindly ask you with understanding to reconsider these blanket mandates at this time. Some businesses are suffering because of it, and it's simply not right anymore. Thank you very much for your time, Bree, and I hope this week is good for you. I also write this with all due respect to your job and position, as I'm sure it's extremely difficult these days. So if there's anyone else for public speak before we move on. I don't see any.
Okay. So that will conclude the public. Oh,
it looks like Lindsay.
Yep.
Lindsay.
Just in the nick of time.
Hi, everyone. Thanks for letting me speak. Sorry to come in so late. I haven't heard everyone's comments. I just wanted to make one myself that I support the Board of Health. As you all know, I'll wear a mask until I'm told not to. I support the science. I would just ask that the Board of Health start considering an end game and a goalpost, whether that be how a percentage of our residents that are vaccinated, CDC guidelines, if we match with the state. I just think for the public, it's hard for some of us to keep wearing masks and watching these things play out without any goal in sight. So I would ask that the Board of Health maybe consider having another meeting next month or in the near future to address what the plan is. Like, are we considering vaccination rates? Are we considering, case rates still? I think we're going to see COVID for a long time. Science supports that we're going to see this much like the flu, even though it's not the flu. We're going to see COVID around for a long time. So I think there needs to be a goal in place. I mean, my 11-year-old says, I'll get vaccinated when the time comes. The time is here, so he'll get vaccinated, but we're still wearing masks. So just a little insight from someone who supports you guys. We kind of need a goal too. So just asking that be taken into consideration. Thank you.
Thank you.
Through the chair.
Nice. So no one else.
Can I guess, Maggie?
Oh, sorry, I didn't hear you.
Oh no, I said, but you can go first. I just said through the chair because I was going to make it say something.
Go ahead, Amy.
Okay. I want to thank everybody for coming tonight to share your thoughts. We've all been struggling with COVID together for the last year and a half. And, as a community, we don't always all have the same vision or viewpoint about how to protect ourselves or those around us. But I value the time that you all spent to come here tonight and share those with us. I think Easthampton has done a fantastic job of protecting each other and being kind to one another. So I want to thank you for that. And also, I think not to respond to the last speaker, but I think the board having that discussion, an off-ramp discussion next month is a really great idea. I think, with our case numbers the way they are, I would request that we put that on the next month agenda to talk about how we safely and intentionally move ourselves to the next phase. So thank you all for coming. And I really think that virtual meetings are so great because I think it allows for better civic participation. So anyways, thank you all.
Yeah, and again, just to echo Amy's sentiments, we really appreciate all your input, your thoughts, and your considerations. And we thank you for showing up and being part of Easthampton. So I just want to conclude the public speak time so we can go on to the next agenda item, which is to approve the meeting minutes from October 5th, 2021. Does anybody have Beth and Amy had a chance to review, and do you have any questions, concerns about last month's meeting minutes?
I've reviewed. I have no concerns. Do you want to make a motion? Yeah, I'll make a motion to accept the minutes from last month's meeting. I'll second that.
All in favor? Aye, Maggie.
Amy, yes. Aye. Yeah, Beth, yes.
Okay. And next on the agenda is Tavern on the Hill. Request for approval to use a 2-bay sink.
Yep, I see Amy. Yep, there she is. Amy Guyette is the owner of Tavern on the Hill, and she is here. Similar to the same issue last month, Brian has unfortunately been coming across some two-bay sinks, and they've just been overseen in the past. And as you know, two-bay sinks are only allowed in food establishments with prior approval from the Board of Health. So, Amy, I don't know if you want to kind of give like an overview of how you use the two-bay sink, what your plan is, and just to kind of
Sure.
go from there.
Sure. So the two-bay sink that we have is used to wash saute pans exclusively. It does not, we don't wash plates, glasses, silverware, anything other than saute pans. We have a dishwasher that is maintained monthly by Ecolab that we wash all of our, the dishes and the glasses and such. So where the sink is located, there is no space for a three-bay sink. And we would have to reconfigure the entire dish room to make that happen. So not sure what we can do to make it work. That's it.
Thank you.
I mean, I don't know what else you guys need to know from us, but I apologize. I have a horrible cold. So I sound kind of froggy, and we're open. So I'm watching on my screens what's going on. So if I seem a little distracted, that's why.
That's okay. You were fine.
Amy or maybe Brian can answer this, but do the dish pans fit in the dishwasher?
That wouldn't work. They're so greasy that if we put them through the dishwasher, we would be having to change the dishwasher water every single time. And the way the system works, it does it filters the water, but it's still, if it gets too dirty, I would say like every 3 or 4 cycles, they drain it and reload it so that's, fresher water. But it just would not work to put them through the dishwasher.
Okay. Bree, where did we end up with the church who wanted the same accommodation that?
They ended up having to I spoke to somebody from the church. She said they had to one of the sinks had to be designated a hand sink. But we already have a hand sink.
I think they had like this huge soapstone sink, and that's separate. They asked if they could use it as a hand wash.
Okay.
So I think that was probably just like a kind of misunderstanding. Let me pull up the letter that we sent after the meeting. So we required.
Yeah, I'd like to be consistent. So I would like to.
Yeah. So the dishwasher shall be professionally serviced to ensure it is functioning adequately, reaching temperature, sanitizing properly, which you do. In this case, the church didn't have a account with Ecolab or one of those types of places. So this was kind of new to them, but this seems like you would be able to provide us that documentation immediately. A dishwasher temperature log is created and implemented.
Okay. So this is a slightly different situation because they were washing all their dishes in the dishwasher, but this is a situation where those dishes can't go into the dishwasher. So it is slightly different.
Yeah.
I also wanted to ask, there's a difference between a restaurant and the church use of the kitchen. So I don't know if that should be taken into consideration when we have our discussion.
There's not a difference in terms of the federal food code.
Okay.
We can have a conversation, but just in terms of the code,
right.
they don't make a distinction.
Okay.
But Maggie makes a good point where, the church kitchen, in this instance, they cook maybe once a month, where Tavern on the Hill obviously is, produces way more food. But we did require a Plan B submitted explaining the planned procedure for using the two-bay sink. The problem with the two-bay sink is there's no way to wash, rinse, sanitize because there's only 2 options. So I don't know what the board is willing to allow.
So Amy, how are you doing it? How are you using, can you explain a little bit more the process that you're using?
Sure. So the pans come off of the line and they go into one side of the sink. We don't ever use standing water in them. Hot water, soap, it's washed, moved over to the other side, and it's rinsed. So they're never being dipped in any kind of dirty water. So they get rinsed off, they get up to dry, they go back to the line.
Okay, so part of the 3-bay process is that they are dipped in that sanitizing solution, which is the kill step for any bacteria that could be on them. So so the process, even if we allow a variance for the 3-bay sink, is going to need the sanitized part of that process.
All right, so we can wash and dry, or we can wash and rinse in one side, have the other side full of sanitizer, dip in sanitizer, and then back over.
How about after you wash and rinse them, could we put them through the dishwasher at that point? So the grease is no longer an issue?
You could, I guess. We have one person that works dishes, and it gets backed up as it is with just running plates and silverware and glasses through the machine. So, I mean, if we have to, we'll figure out how to do it, but it would cause a pretty good sized backup, I could imagine.
Yeah, no, I'm not saying that that's what you have to do. I'm trying to think of the best and easiest way to get to compliance that doesn't, put a wrinkle in your system, and also isn't an unrealistic process that's just not going to happen. I mean, we could all say, oh, we're going to do this, but if it's not realistic for your operations, then it's not actually meeting the intention. So Bree or Brian, I don't know, or Amy, you could answer. Is there a place, is there like with the 2-bay sink, is there a ledge where they could wash and then rinse and then fill up that third bay with the sanitizer solution?
No, there's no ledge because there's just no space for it. It literally fits in the small space that it has. We've looked into 3-bay sinks that could fit in that size, but then we can't fit the pots and pans in them. It makes each thing so small.
Defeats the purpose.
Correct. Yeah.
Do you feel confident that if you were to pre-scrape all of the pans and wash and rinse them in the first bay and sanitize them in the second bay, that you would be able to get all of like the oil and food debris off in that first step? Because if you still have food debris on the dishes while you put it in the sanitizer literally doesn't work. So you have to have them like completely clean.
Yeah, I mean, it wouldn't. Yes, I would think that they would be able to get it washed and cleaned, and then.
It doesn't sound that much different than the process that you're doing now. It's just really the 2-bay is less of a problem than the lack of the sanitation step, I think. So, Amy, can you submit a plan to Bree with the modification in your plans to still hit the 3 stages of the wash, rinse, sanitize?
Sure.
And then next month we could take a look at that and talk a little further. I don't think you need to come to the meeting unless you want to. I mean, we're happy to have you, but I know while you're also trying to run a business, it gets a little tricky to attend night meetings. So we could review that with Bree at the next meeting, and then she could be the conduit of our conversation if that's easier for you.
Yeah, I'm just writing this down.
Yeah, and Bree can follow up with an email tomorrow, so you don't have to be trying to write out. She'll lay out exactly what we're looking for from you. And then Bree, I'd ask, it's been a little bit since I've done this, but I also, in the sanitized process, is the air dry a requirement after that sanitizer step so it can actually kill the bacteria?
Yeah, you're not like, you definitely don't rinse. I don't think you're supposed to wipe them either. So it has to be air.
No, you definitely can't wipe them. My question is, so it's technically a 3-bay sink with a 4-step process: wash, rinse, sanitize, air dry.
Yeah.
So if they're
we have a shelf above the machine or above the sink that we will, after they've been washed, they sit up there to get the majority of the water out of them, because you obviously don't want to be bringing wet pans over for them to try to cook in. So they can that step can happen, and it'll just, rather than to the side, it just happens above the sink.
Okay. So I think we're getting close to a solution. And Bree will send you that email tomorrow. And I'm sure if Ecolab does your dishwasher, asking them to put sanitizer on that second bay shouldn't be an issue for them.
Did you guys want to implement the similar requirements of the church, which was proof that the dishwasher is in compliance, or is this kind of a different issue? Because
I think it's a whole different situation. The church was using the dishwasher for everything. And we're now dealing with just how they're doing their pots and pans. I think if they have Ecolab come in monthly, whereas the church hadn't had Ecolab come in or anybody come in to their memory, right? It seems different. There was one other thing I was going to say. Amy, just while I have you, so it doesn't come as a surprise. If we do grant the variance for this, I don't know how the other board members feel, but I would put in the variance that when any kind of modifications are done to that area, that you upgrade to a space that allows for a 3-bay sink.
Definitely.
Oh, sure. That would make sense. Yeah. No worries.
Okay.
What about if the dishwasher is to go down? I think, Amy, you said that you would just close, but I think that should either be in your plan or something, because right now, I mean, dishwashers, a lot of the times we go in and test them and they're not up to temperature. So since that is your main way of washing dishes, we would want some type of plan, like you said, close, because I don't think you could probably do all of your dishes with this one 2-bay. So
we've been here since 2005. We've had one time our dishwasher went down and they weren't able to come up and fix it. And we have had our dishwasher go down, but we call Ecolab and they're usually here within an hour.
Okay.
We've had it happen one time since 2005, and we used all the dishes that we had until we had no more dishes, and we shut the doors. We are not standing here hand washing dishes, period, and don't care. Sorry, take it to go. We'll serve it in to-go containers.
I don't even like doing the dishes with my family dinner every single night. I can't imagine doing a restaurant with hundreds of people.
Yeah, it's disgusting enough that I have to touch them from the table to the dish room, let alone sit there and wash them.
All right. Well, Amy, thank you so much for coming tonight. I think we're going to be able to find a solution that is agreeable and also make sure it meets the intent of the code.
Okay, sounds great.
Thank you.
Thanks.
So do we need to vote on that or wait till Amy
you guys can vote in December? Maybe I'll bring it back to you in December and vote on it then.
Wait till December. Okay.
So if you want a plan from Amy to be approved or not approved, and then we'll count that as like the Board of Health approval.
Yeah, so next month, just work with her between now and then to come up with you and Brian know really what meets the code, right? So between now and then, you guys can do multiple iterations of whatever. And if she disagrees with you, then she's going to clearly just come back to see us next December. But I have a feeling you guys are going to be able to work out a plan that allows for the same level of safety as a 3-bay sink. And then we'll vote on it next month.
Okay. So next item on the agenda is the Hampton East Condominium Trust determination whether to reopen and renotice the public hearing. So it looks like there's a lot of people here from the Condominium Association. So the question in hand is for the board to have a discussion about whether to reopen the public hearing because of some questions from the Condominium Association. And, they feel that they would want more discussion about the well for their irrigation purposes for landscaping or wells. So I'm taking the stance that I would like to reopen the hearing. I feel that there may be some more discussion that would be appropriate for us to hear. But obviously this is a board decision, and I just want to hear from Beth and Amy, any thoughts that you might have on that.
I am happy to rehear it. I do feel like we followed all the Mass General Law required for us to do in order to have a public hearing that meets the extent of what we need to get done. But in the interest of having our residents feel that we are open to having greater discussion, I'm happy to move forward, but I do want to state for record that we followed the Mass General Law practices for the hearing.
Yeah, I agree with both of you. I think at this point, it's probably in everyone's best interest just to move forward and have another hearing so that there's no question in the end, that everyone who needed or wanted to be heard was heard, and we make our decision, and it's an informed decision. Not that it wasn't before, but now, we can end the discussion.
Right. And it would be, as you both said, an opportunity for residents to have their speak time about their concerns. So we do need to take a vote on that. So the next meeting would be in December. So I call for a motion to reopen the public hearing for Hampton East Condominium Trust for their request for private well for landscaping irrigation.
I'll make the motion to rehear their request.
I'm gonna ask for discussion.
Okay.
Can we modify the request to specify the date of the hearing? Because I think some of the concern last time was in our meeting, our motion did not have a date attached to it.
Correct.
And that way everyone that's here is aware of the date we will hear their concerns. So I'd like to just amend it.
Yep.
It's December 7th.
Okay. So amend that to put the date of the meeting December 7th, 2021.
With the amendment, I will second.
All in favor? Maggie, yes.
Beth, yes.
Okay. So we look forward to seeing all of you again December 7th. And then next on the agenda is the update from our health director, Bree.
I can share my screen again for the Board of Health data if you want, for the COVID-19 data. I sent it to you prior to this. I don't know if you want to see it again, or if you want me to share my screen, just let me know.
I think we had a lot of people who were concerned today about our mask mandate, and sharing the screen will allow this to be recorded. So I think so people can one-stop shop. Let's go ahead and share that screen.
Okay. Okay, do you see this Excel?
Mm-hmm.
Yep.
Okay.
Yep.
So this is the Easthampton 14-day daily average per 100,000.
I'm going to interrupt you for 1 second. Can you on the bottom right? You can see there's a way to magnify it a little bit.
Yes. Do you want to?
Yeah, just so people can see. Yeah. Go a little bit more. There you go. That's good. Thank you.
Perfect. Thank you. From June 4th to today, June 4th to 10/28. I take these 14-day daily averages right off of our dashboards, which can be found on our Facebook page or on our website. And you'll see from June, obviously very low. We had a steep increase in August, another decrease in September, October. We're going up a little bit again. I have weekly cases from June again to present. It shows pretty similar trend. And I also have weekly cases from the beginning of the pandemic, January 1. Do you want me to switch or does? You good here?
Maybe go slow so people have a chance to look at the data, Bree.
Yeah. I know it might be small, but this is the weekly case numbers from June 2021 to present. And then the next tab that I'll show you is going to be the weekly cases from the beginning of the pandemic. And the reason I did that was so you can kind of see where we are today compared to when, throughout the entire history of the pandemic. So again, we were low in June. We shot up August, September. We came down a little bit here at the end of September. We rose up again in October. And this is up until yesterday, the week of 10/27 to 11/1. I'll also pull up our data dashboard after. These are the weekly cases from the beginning of the pandemic, and it's going to be small, but this is from January 1, 2020 up until yesterday. So I just wanted to kind of show where we are in general. If you want me to zoom up to any numbers or any specific numbers or questions, just let me know.
So that peak number, Bree, when is that?
The 92 looks like it was right after the holidays, 12/30 to January 5th.
Oh, January 5th of 21?
Yes. So that looks like after the holiday season from 2020 to 2021.
Yeah. But it's interesting to note that last year at this time, we were lower in our infectious rate than we are, our cases than we are right now. Right? Am I reading it right?
So November 1 of last year was right around here. So yeah, 9 weekly cases.
So last year at this time, we had masks. And we had less cases than we have right now.
Correct.
It looks like
part of that is Delta though, right?
Yeah. So it looks like the last time we were around the same case number was the beginning of December, which is when things really started getting worse.
Yeah, and you see kind of that obvious increase right around 12/16 to right around here, which is mid-January. So that holiday kind of increase was very apparent. I remember the week of the 92 cases, and I think, Amy, you had similar cases in your community at that time too. So it was a notable time for sure. I can pull up
it's been a notable year and a half for sure.
Yeah. 2 years.
2 years. Okay. Well, I think, I'll be personally really curious to see where we are next month.
When we January after the holidays and the cold weather.
Mm-hmm.
Sorry, Amy, I didn't mean to interrupt you.
No, we're good. I'm good. Thanks.
All right.
Okay.
Figure out how to stop sharing.
Usually.
Oh, there it is. Okay.
Usually where it says stop sharing.
It's stressful when I know people are watching.
I know.
And I can also maybe ask Megan Harvey, our contracted epidemiologist, to come and speak in December. She's the one that's putting our dashboards together. And she has, throughout the pandemic, just been a really, plethora of information. And she studies this stuff day in and day out. So I think it'd be helpful to hear from her if you would like me to invite her next time.
Yes,
I think that would be great.
And also our new public health nurse.
Yes, she is on. It was too late to add her to this agenda, so I will introduce you to her at the next meeting.
And that way, folks that have questions and concerns, Megan can try and address all those, the things that people spoke about tonight. We can have some response to that.
Alrighty.
And the dashboard is our data. It's not from the state, right?
It is, well, we get it from a couple different sources. We get it from Maven. I run a report to the 2 previous Sundays back and to that Thursday. Megan also gets it off of the state website as well. There's a raw data that you can access right on mass.gov. So she goes through that and kind of picks it apart and figures out kind of what she's reporting on. But we are back in the yellow. So we did dip down to all green for the 7-day, 14-day averages 2 weeks, I believe, 2 weeks ago. And then we were kind of split green and yellow between the 7-day and 14-day, and now we're back to yellow again. So there was that decrease, which I think kind of garnered a lot of, emails and questions about the mask mandate. But it's just that we're kind of back on the rise for now. So like you said, it will be interesting to see where we're at. So that's
in place in August, right? It was August.
It was effective around September 4th, I believe.
Yep. Okay.
And I would just like to state for the record, coming from the enforcement side of it, I really want to be sure when the board decides to lift it, because I don't think that it makes a lot of sense for us to lift it and then reissue it again in 2 months. And I don't think that makes a lot of sense. Of course, if it ever came to the point where it had to be done, we would do what's right. But I don't want to lift it, reissue it, lift it, reissue it. That's not really, something that I think is in our best interest, but those are my 2 cents.
No, I agree. And the winter months are going to be telling, the cold weather and everyone indoors. So there's kind of a question about where the body of literature on our website is, Bree.
Oh, yes. You know what? I was on vacation when that dashboard was posted. So I had asked somebody else to post it for me, and that part didn't make it, and I need to add it. It was, I thought I did add it, but I will go back because it does say, so whoever wrote that, Jean Powell Wilson, you are correct. It says body of literature, for more information, see below, and it wasn't posted. So I need to either add that or I did add it, but yes, I will do that.
Bree, do you think it's possible that if we just put a timeline on that, so it's like a measurable goal by the end of the week, Friday or Thursday night?
To what?
To have that updated, so Jean has a reference on when she should go back and look at it.
Yeah, I can do it right now.
No, Thursday. I don't need to do it right now.
It doesn't take me long.
I know you have 100 things on your plate. I'm just so Jean has a time. Like you leave Thursday night at 5. Can she expect that it's done by Thursday at 5 at the latest?
Yes.
Okay.
Thank you for reminding me, because I remember I looked at it while I was on vacation, and I remember thinking like, oh, where is that text? And then when I got back, it was in the original email. It just needs to go out. So thank you for that. That's all I have for COVID-19 data update. And then we can move to the general update if you're ready.
Yeah, I think unless Amy or Beth have any other questions.
Not at this time.
Okay.
For the general update, just again, I'm going to be out 11/17 and 11/18. I'm not going anywhere crazy, so I'm around. I just wanted to let you know I'll be out of the office, but I will be available via phone and somewhat email. Public health nurse position, that was approved at City Council to move up to the next grade up, which is more in line with other surrounding communities. So, in order for us to attract and retain candidates, and we were able to hire Bridget Diggins to be our nurse. She is an RN and she has her master's in public health. She worked as an intern with Hampshire Hope out of the Northampton Health Department, and she's also an RN at Cooley Dickinson. And she's just really excited about public health nursing, which is good. And we're excited to have her. And she's getting up in Maven this week. It takes, unfortunately, like 1 to 2 weeks, but the timing is kind of perfect because the CTC is dissolving at the end of this month. So it will kind of be like a perfect transition.
Nice.
The community social worker position was also approved by City Council. That's going to be funded with ARPA dollars. I'm just waiting for approval to post it. The job description's ready and everything, but we've got to, find office space and make sure that that position is already set up for this person. And we'll be posting that soon. And those are really...
We'll work with the public health nurse or like on, behavioral issues or what?
Yeah, I think it's going to be interesting because it's a brand new position. So this person is going to, have to be ready to kind of build it out. I think one of the first things that person will do is kind of do like a needs assessment to figure out exactly what is needed in Easthampton so they can kind of hone it in. But they'll work in conjunction with our public health nurse, with inspectors on housing issues. And there's not a lot of support for social services around here. We run into a lot of kind of dead ends. So this will be good to have someone right in-house to help us with those. They'll work closely with the CSO, community response person out of the police department. They're kind of more of like a crisis response, and this is going to be more of a long-term assistance. And they'll also assist with connecting people to resources, helping with signing up for food stamps or benefits or anything, oil assistance, stuff like that. So I think they're going to have their hands full. There's going to be a lot of work. And City Council President Conniff said it right. She said, this position is very well needed, but don't try to save the world in 1 year. We're going to have a lot of work for them. So I'm excited.
Yeah, sounds great.
It's great.
And it's also, there's a, there's a couple positions in Massachusetts like this. And I spoke with the town of New Bedford, city of New Bedford, and they have this position in their town. So they were really helpful with kind of creating the job description. And they, I think, will be willing to meet with our new employee and kind of give them an overview of what they do. So that's my plan for now.
And just quickly, Jean was asking, what is CTC? It's the contact tracing. I can't say.
Collaborative at the state level. They assist when there's when a community needs assistance. So they assist in all different types of situations. If a large city like Boston can't keep up with the contact tracing, they'll kind of take over smaller towns that lose their public health nurse, and they kind of go through a gap of not having help. They step in, and they did that for us, and they've been extremely helpful, and we're very grateful for them. But we're also excited to have our in-house nurse again who can help with answering questions from the businesses and community.
Yeah. And Jean also asked what ARPA is.
The American Response
Restore. It's from the federal government. It's money that is being designated to the state as a pass-through to communities for a variety of things, not just COVID response.
And Megan Harvey is a contracted epidemiologist contracted by the city using a grant that we received from the Pioneer Valley Planning Commission. So that's what I've got for an update.
Great. Well, thank you, everybody. We'll see everybody on December 7th.
Yeah, so I guess call for motion to close the meeting November 2nd, 6:35 p.m.
I'll make a motion to end the meeting. I'll second that.
All in favor? Maggie, yes.
Amy, yes. Beth, yes.
Great. Thank you, everybody.
Thank you all. Thank you.